Hispanic Culture and Nursing by Wendy Letchworth. Introduction. So the purpose of this presentation is to evaluate the Hispanic culture over the lifespan. The plan is to explore literature research to gain perspective of the Hispanic culture, and the goal is to learn ways to provide quality nursing care to those in the Hispanic culture. The Hispanic Culture Introduction. So the Hispanic culture is just a term used by the U.S. Bureau of Census to group Spanish-speaking people. This is the largest minority group in the U.S. It's 14% of the total population, and culturally it's very diverse. It comes from several different countries, the people do, approximately 11 different countries, but it's not limited to those 11 countries, such as Mexico, Puerto Rico, etc. They define health as a gift from God. Folk medicine is largely used in the Hispanic culture, and it's also used alongside Western medicine in the U.S. So folk medicine in the Hispanic culture, there's lots of different terms on this page. I might not pronounce them correctly. So let's begin. The curandero they received a gift from God to cure. They can treat using herbs, diet, massage, and rituals, and they treat traditional illnesses typically. They typically don't treat with the witchcraft or treat witchcraft to avoiding being associated with that. Santeros, these people heal through the saint's power. They can treat witchcraft. They're used for social, psychological, and physical illnesses. The espiritualistas, they analyze dreams, foretell future events, and they help to mainly prevent illness. They use prayer, amulets, things like that. Sabador, they believe in the massage, bones, muscles. They treat traditional illnesses. And Yerburro grows and prescribes herbs for traditional and Western illness. So nursing care specific to the pregnant Hispanic woman. So during pregnancy, I looked at an article by Baxley and Ibidio in 2015, and it said that the women prefer the following. They want to feel comfortable, not rushed, and they want to have a friendly demeanor when dealing with the providers and the nurses, to have a smile. They also would prefer to have providers who are culturally sensitive, that faith is very important, and that they believe in God. Typically, Hispanic people are Catholic. They speak their language. They prefer someone who does speak Spanish and that is bilingual. And they prefer you to be transparent and direct. There was a narrative section, and one of the ladies kept saying, "Tell me everything, tell me everything." The facts. Acculturation leads to lower birth weights, with higher risk pregnancies due to the chronic stress. So with this study by Ruse, they found that the first generation or new immigrants had more successful and higher weight babies than did, say, the third generation. The highest birth rate among minority groups are due to lack of resources, and the babies are often in unfavorable circumstances. The ACA aids in affordable care insurance, and often they believe in traditional ways such as the midwives, the support persons, and informal care for Hispanic communities. Nursing care specific to Hispanic babies. So the biggest thing I could find for Hispanic babies is that education for feeding is very necessary. Many Hispanic babies are overweight and overfed. They're started on solid foods much earlier than the recommended 6 months old. At 2 months, some of the groups of Hispanics start adding sugary substances to the bottles, and breastfeeding is initiated higher in Hispanics than whites and blacks. However, it's often not carried out the recommended 6 months. And mal de oro is a supernatural cause of illness. This is also translates as the evil eye. It's overly complimenting the baby. It can bring on sickness. The baby may wear an onyx charm to prevent this. So if you work with babies in the NICU or just on a maternity floor, you may see this. So it's something to be aware of. So nursing care specific to children aged 1 to 17. Obesity rates for Hispanic children is much higher than their counterparts of African American and Caucasian at 14.8% in 2014. For nurses, it's important to encourage a healthy diet and encourage outdoor play. Due to the low income and the variation in health insurance, the access to eye and dental care should be encouraged at a young age. It was also seen in this study by Rhee that dental care, if the mother sees that it's beneficial, then she's more likely to continue it. Then the primary care provider should also check the eyes and dental care at routine visits because it's likely that they may not be going to these extra providers. And also, since Puerto Ricans is a subgroup of the Hispanic culture, 1 in 5 Puerto Ricans suffer from asthma, and this is in children. It's very important for nurses to be knowledgeable of the resources in your community. Most everywhere in the United States offers WIC. One program I read about was Moms Adopting Moms. I think this was in California, where mothers adopted a mother from another country. And also, community health care clinics are a great opportunity, along with MOPS, which is Mothers of Preschoolers, where moms can get together with other preschool moms, and often they are held at churches, especially churches with Hispanic groups and other cultures. So nursing care for adults aged 18 to 64 in the Hispanic culture. Hispanics have a high prevalence of diabetes compared to other cultures. Diabetes and depression are often comorbid. However, due to socioeconomic barriers and psychotherapy, they're often not diagnosed. Heart disease is the leading cause of death for Hispanic individuals. Hispanic women have twice the rate of cervical cancer than white women, and they are diagnosed with HIV at twice the rate as white individuals. Now, mental illness may also be seen as witchcraft or supernatural, and if admitted to a psychological institute, it may be called, the individual may be called a loco and lose social status. The entire family makes important healthcare decisions such as surgery, placement in a long-term care facility. So the main issues when dealing with adults, because this age range from 18 to 64 is so broad, is just to remember to teach about prevention, to encourage a healthy diet and exercise, to aid with the diabetes and the depression, to always assess. For the depression, to assess for lifestyle factors, for stress management, and these will help decrease the negative outcomes that are possible. Community care for Hispanic culture. Community healthcare workers increase compliance with BMI reduction, dietary habits, and diabetes management by including cultural traditions, family members, education, training, and social support. And this was compared to a clinical, typical community service agency. Migrant healthcare workers are entitled to the healthcare services under the Affordable Care Act. Community clinics such as the Harvest Family Health Center, which is a local center to me, with Spanish-speaking providers and culturally sensitive care. The specific facility originated for migrant workers in tents, and now it has a very large facility out towards a rural area. And low income, lack of resources, and social supports makes finding a primary care provider difficult. So, to summarize this, the Hispanic culture is a mixture of Spanish-speaking countries that is the fastest growing minority in the U.S. Healthcare is often a mix of folk care and westernized medication in the U.S. Importance for nursing is placed on building rapport, being positive, transparent, and being able to provide care in Spanish. Always ask about herbal medications, any needs for religion, and include family as the patient would prefer. Children face issues related to obesity and asthma. Adults have a high prevalence rate of diabetes. Elderly are less likely to be in long-term care facilities, but there's a growing trend for this. And community services are beneficial to promote health care outcomes across lifespans. And here are my references.